Doctors of Reddit. What's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? Doctor here. It is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be chipping in. For more generic conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor as they can prescribe drugs or order tests for me that would be difficult or questionable for me to do myself. Doctor here for family medicine. I self-diagnose most things, but for my 1-year-old daughter, I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health, that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist, for a routine checkup, I sometimes just don't say what I do, so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with other patients, because he can be sure I understand the medical pros and cons well once I'm given a basic explanation. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do, I usually don't say anything, especially if it's in a field of medicine I have no idea about. Let's say dermatology. That being said, the doctor usually knows I'm a physician as well, and so the language terms tend to be more technical. I also find that we practice less defensively with each other since we can be more open. My mom's a general practitioner, and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community for stuff like getting ultrasounds, etc. Then yes, they do discuss stuff like it's a group project. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk, where I simplify medical terms for laypeople. Sometimes it's also challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse and she said, I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, like labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Doctor here. In general, we are not good about going to the doctor. For me, it's physicals, about half as often as recommended. And that time I had strep a year and a half ago, that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. I was at a lecture a couple of years ago performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself. You couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, and what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. Doctor here. Like someone else said, if I'm seeing a specialist of a particular field, then I am unlikely to have anywhere near as much knowledge as them, so I would consult with them just like any other patient. If it's something more general and I'm seeing a general practitioner, for example, I will tell them I'm a doctor so that they don't go into the lengthy layman's explanations. But generally, we'll try to have a normal doctor-patient relationship. I might throw in an opinion on what I think, but ultimately I try to just shut up and respect that they are a professional and not tell them how to do their job. It's hard to be objective too when the patient is yourself or a family member. Having someone give their unbiased opinion is often more useful than self-diagnosing, or at least might add some more knowledge or insight that you may not have yourself. Being a doctor is a really difficult job. The pay can be good, especially if you work in a first world country, but there are times wherein you have to make some tough choices. We're done for today. I hope you learned something from this video. Stay safe, everyone.